Hi, I'm Jonathan Chainey. I'm a neurosurgery resident at University of Alberta, and today I'm going to present my research project on neurosurgical expertise, evidence from drilling task. I have nothing to declare. Decompressive lumbar laminectomy is one of the most common spine surgery. It is used to treat different conditions such as spinal stenosis, herniated disc, and tumors. And in this procedure, the surgeon needs to drill the posterior elements of the vertebrae to gain access to the spinal canal. And the power drill often generates significant amount of mechanical vibration. And vibration can be challenging for the surgeon who need precise and controlled movement to avoid damage to neurological structures. Another factor that can affect the surgeon movement accuracy is the interaction between the drill bit and the bone. And there is a lack of scientific literature regarding the surgeon movement accuracy during a drilling task. In this project, we are analyzing gaze behavior of expert and novice neurosurgeon while performing a lumbar laminectomy on 3D printed lumbar spine model. And we hypothesize that expert and novice surgeon will display different performance as measured by movement and eye variables. So we had 4 expert and 3 novice neurosurgeons performing the drilling task. We define expert as board certified and independent neurosurgeon, and novice as neurosurgery resident currently involved in a training program. The picture on the left shows the lumbar spine model, and the picture on the right shows the box covering the spine with a hole, creating a surgical environment with a deep surgical field, which is more representative of real life. We recorded the video of the performance from the surgical microscope as well as the eye tracking data from the Tobii Pro 2 glasses. And this picture showed the surgical microscope and the wearable eye tracker. So using the open source event logging software Boris, the video of each participant were analyzed. We identified in each video the jumping event and analyzed the eye fixation associated with the event. First of all, we define jumping event as a moment where the drill bit moves unexpectedly and evident loss of control of the instrument is shown. And for the majority of these events, an eye fixation would be associated with this. Therefore, we were able to compute the pre-jump fixation duration, which is the length of time from the beginning of the fixation to when the jumping event occurs. And the post-jump fixation duration corresponds to the period from the jumping event until the end of the fixation. And the total fixation is the sum of the two. In addition, using the Boris software, we were able to measure the jump distance, which is the distance in millimeters from the drill bit location before the jumping event occur to the furthest location of the drill bit during the jumping event. And we perform an independent sample t-test of these different variables over novice and expert surgeon. This table shows the result of this analysis, but it is easier to understand it with the diagram on the next slide. But first of all, I want to point out that novice neurosurgeon had a higher number of drill jumping events and longer drill jumping distance, which indicate a lower degree of control of the drill. We believe that these results can be explained in part by the detrimental effect of vibration caused by the power drill. Expert surgeons with their numerous hours of drill manipulation might have developed a strategy of upgrading their threshold to their sensory pathway. The Fibro tactile adaptation phenomenon might explain these findings. And this adaptation is characterized by a reduction of vibrotactile sensibility, such as hypoesthesia, or by increasing the vibration detection threshold. So the expert doesn't feel the same amount of vibration than the novice. The diagram on the left represents the result of the gaze analysis. It revealed that novice tend to have a longer post-jump fixation duration than expert. In other words, when an unpredicted event happened, such as the loss of control of the drill, the novice took longer to adjust his gaze and analyze the situation so he can adjust his movement. The motion analysis, which is the graph on the right, shows that on average a novice will move the tip of the drill 1.5 centimeters further from where he was working just before the jumping event. So in conclusion, differences in movement accuracy and eye measures were found between expert and novice during this drilling task. Novice had increased jumping event and jump distance compared to expert. Novices had longer post-jump fixation duration than expert. And eye-hand coordination measures can be used to discriminate surgeon level of expertise. and novices need time to practice before gaining control of the drilling tool, and this should be done in a simulation environment. Thank you, and I'm happy to answer any question.